My name's Megan Landis, and I'm an emergency doctor here at the UHN. I grew up in the Maritimes, and I think that early on I had that sense of wanting to act in this world. I studied international development and then volunteered to go work on a aqueduct building project in Costa Rica. And after that I spent a summer in Burkina Faso during my medical school training.
Your CT results are not back yet. Your CT, you need to get the results from your CAT scan.
My day job is in the emergency department.
This lady is greater than 48 hours.
Okay.
And this one has had 3 ablations.
We're a training center, so we always have residents with us, medical students, nurse practitioners.
Just looking at, just leave this here for you. Yeah.
I came to UHN in order to join the Global Health Emergency Medicine Group, which was a new and novel idea by our chief in order to allow emergency doctors to do both global health as well as practice here in Canada.
We're very cognizant that we have to provide the best local care, but we also want to reach the rest of the world. Because we know that eventually work within UHN and outside of UHN is going to help patients all over the world.
In 2008, I got a call asking me to participate in the Toronto Addis Ababa academic collaboration in emergency medicine. There's none of the things that we would consider to be essential in our emergency rooms here.
There was a very basic arrival area where people would show up in the most tragic and challenging conditions.
We have shortage of homes, shortage of staff, and shortage of medications, as well as some of investigation modalities in the hospital.
In a place where there's very few seatbelts, very few sidewalks, quite a lot of road traffic accidents, the amount of trauma that we see there is tremendous. And what they would do is, if you came in and you couldn't breathe or you were seizing, you still sat in line and still waited.
You walk in and you recognize immediately that the lack of resources, the lack of training, the lack of people to work there with the skills that are needed.
And so the trick becomes, how do you actually develop an emergency system when there are no trained specialists?
When we started it, we never had any emergency medicine specialists.
The TAAAC team has been there with us since the beginning of our training. This team has been teaching us how to save lives in the emergency department, and I think we have learned a lot from the team.
What we do is something very unique, and that is take the University of Toronto and the University Health Network teachers with us to Ethiopia to deliver a longitudinal 3-year curriculum. So we go for a month at a time. We deliver some lectures. We spend a lot of time in the emergency room actually seeing patients and treating patients and doing what we call bedside teaching, which is standing next to the residents that are learning this new skill of emergency medicine and clinically mentoring them through resuscitations or traumas or the sick patient that they haven't previously really been mentored in terms of emergency medicine.
The last time I went to Addis Ababa, it was amazing. What impressed me was people were getting help. People were getting treatment. There were teams of doctors and nurses around the patients, around the beds, working together.
I would have to say that our Ethiopian trainees are amongst some of the best and brightest that I've met around the world.
What they've been able to do with very modest resources is to build an incredibly strong program that's making a major difference.
It's really been a privilege to be part of this project in Ethiopia, because the legacy is really the beginning of emergency medicine in a country of 80 million people.
So from now, the next 5 years, then we will have enough or good number of emergency physicians in the country working, teaching here in this department, and also practicing their practice in other non-teaching hospitals.
Ethiopia is poised to be the center of excellence for emergency medicine training in that region.
That's good. Slowly, gently.
The program in Addis Ababa is being recognized in other African countries as a model for healthcare delivery and education. Neighboring countries are sending people to Addis Ababa to learn about it.
It is going to be one of the center of excellences for emergency medicine, at least in the East Africa.
For the people that get involved in this project, it changes us tremendously. So I know that I am a better doctor because I practice in Ethiopia.
This initiative, very simply, says that the University Health Networks take seriously its mission of global impact.
It has really a great impact for the whole nation.
It's really been a privilege to be part of this project in Ethiopia.
They're going to be the first emergency doctors in their country, which is amazing.